Hello, everybody. Welcome to our February the 4th rounds. Today we have the Parry Sound Drug Strategy team presenting to us, and I'll pass it over to Sam.
Thanks, Kathy, and welcome, everyone. I hope you can all hear me okay. Just a couple of quick housekeeping items. If you can just, I see that there's still a couple of people connecting to audio, but if you could please just mute your mic while the presenters are speaking, just to decrease any background noise. And we will hold the questions till the end. We have hopes of having about 15 minutes for questions, as long as we get through all of our materials, but we'll have lots of time to answer any questions you might have at the end. I'm just going to start by acknowledging that we're hosting today's meeting on land that has been inhabited by Indigenous peoples since time immemorial. We sit on the traditional territory of the Anishinaabe people and within the lands protected by the Robinson-Huron Treaty of 1850, used by members of the Nipissing First Nation. We acknowledge, this land acknowledgement is a little bit more specific to the North Bay area. I'm with the health unit, but just, bear with me. We acknowledge that we're also situated on the unceded territory of the Algonquin Nation and settlements of the Métis Nation. As individuals and organizations, we're dedicated to honoring Indigenous history and culture and committed to moving forward in the spirit of reconciliation and respect with all First Nation, Métis, and Inuit peoples. So I'm just going to share my slides here. So you'll just have to bear with me for one quick second, and we will get started. So, welcome everyone. So today our topic is the Parry Sound Drug Strategy, talking about how opioids, street drugs, and alcohol are impacting our patients, clients, family, friends, loved ones, and our community as a whole. And within the Parry Sound Drug Strategy, we really look at a community-wide approach. Sorry, we'll do introductions in just one quick second. I just wanted to do a quick disclosure that today's session hasn't received any financial or in-kind support, though some of our presenters are employees of local agencies. So I'll start introducing myself. Because I'm sharing my screen, I find it a little difficult. I can't see everybody, but I'm Sam Doherty. I'm a community health promoter with the North Bay Parry Sound District Health Unit. I'm based out of our Parry Sound office and am co-chair of the Parry Sound Drug Strategy. I'll pass it over to Connie to introduce herself.
Hi, everyone. So I'm Connie Foster. I'm a manager and a nurse practitioner at the West Parry Sound Health Center, a rural nurse practitioner-led clinic. I'm one of the 6 sites at Moose Deer Point First Nation. And I'm also the West Parry Sound Health Center Indigenous lead and the co-lead too as well of the Parry Sound Drug Strategy. I also oversee as one of the co-leads of the RCAT RAM clinic, so the Rapid Access Addiction Medicine Clinic run out of the West Parry Sound Health Center. I do oversee the medical oversight for a home withdrawal management program for Simcoe Muskoka and provide addiction consulting services to Greenstone Detox and Recovery Center in Bala. Nice to be here. Thank you.
My slides now. Melissa, if you could introduce yourself.
Hi, I'm Melissa Jackson. I'm a lived experience advocate, and I've been a member of the Parry Sound Drug Strategy Committee since 2021, and I'm honored to be here.
Thank you so much. And Bruce. Oh, sorry.
Bruce, you're on mute.
Yeah, sorry.
Sorry, folks. That may happen again. I'm Bruce Fox. I'm an OPP officer in Parry Sound. Been here since 1999, and presently I'm with what they call the Community Street Crime Unit of the Northeast Region. And my job in Parry Sound is primarily to investigate drug offenses and property crimes, and mostly drug offenses. So that's my role here, and I've been with the Drug Strategy Committee since its inception. Glad to be here.
Wonderful. Thanks, everyone. So I'm just going to quickly run through our agenda for today. we are going to go through a high-level overview of the current opioid situation, both with a broader context as well as getting down to a bit more of a local context. Then we'll take a run through the Parry Sound Drug Strategy, so kind of who we are, what's our vision, our goals, and what our membership looks like. And then we're going to go into a bit more detail of some current strategies and initiatives related to the drug strategy, as well as some next steps and future work that we're in the process of developing. And again, we'll have some time for questions at the end. So I'm going to just pass it over to Connie to talk about the broader context of the current opioid situation.
Okay, thanks, Sam. So globally, we have had previous opioid crises, but the current one has been the worst over the past decade. The WHO reports worldwide approximately 0.5 million deaths are linked to drug use. Greater than 70% of these deaths are directly linked to opioids, and greater than 30% of these deaths are from opioid overdose. This decade, the deaths from overdoses are directly related to non-prescription opioids and have increased greater than 70%, considering the global population has only increased by 10% in the last decade. So we can see just with those numbers how great this opioid crisis is. Barriers faced throughout North America are entrenched in opioid prescribing practices and comprehensive policy approaches addressing barriers to appropriate care. Since 2013 in the USA, deaths from overdose have surpassed motor vehicle accidents, making it a leading cause of preventable deaths. Canada is not too far behind. Other barriers are drug trafficking and clinicians' ability to implement comprehensive, widespread medically assisted treatments. In contrast, in Slovenia, Croatia, and Switzerland, they have a widespread availability of Suboxone and methadone. And findings indicate this is contributing to low rates of HIV prevalence in injection drug users. Primary care efforts to bridge the gap is a strong focus in North America. One of the leading public health concerns in Canada is the opioid crisis. Between 2016 and 2020, an estimated 6,819 people died from fatal overdoses. In Ontario, accounting for 35% of the total deaths during this time frame. This issue is multifaceted between prescribed and unprescribed opioid use. Polysubstance use disorder, including alcohol, has also been identified as a major reason to access emergency departments in Ontario. This is linked to a high one-year mortality with low hospital admissions during the time of accessing the emerge departments, indicating they leave with unmet needs. Ontario saw 60% of in fatal opioid related poisonings in 2020 with 2,431 preventable deaths compared to 1,529 fatalities in 2019. The first half of 2021, 34.3% increase in drug poisonings compared to the same period in 2020. Rates of fatal drug poisonings are more than doubling in 15 to 34 public health units in Ontario. Next.
Sorry, my slides are a little bit delayed when I click them here. So I'm just going to share some data that we have around our local situation. So currently our health unit region as a whole, so that's Nipissing and Parry Sound districts, from January to December of 2020, we saw, unfortunately, 51 opioid-related overdoses, opioid-related deaths. And our health unit region currently has the 5th highest opioid-related death rate in Ontario, sitting at 39.4 per 100,000. So for comparison purposes, from January to December of 2021, as I mentioned, there was 51 opioid-related overdoses. And in that same time period in 2019, there was 19 opioid-related overdoses. So more than 2 times increase during that time. And something really important and kind of sad to mention is that, so we sit at the 5th highest per capita, but it is all of our northern counterparts who are or higher than us. So it is a situation that we're seeing really impacting our northern regions more so than some of our southern counterparts. And then Looking more specifically at the Parry Sound region, so from January to December of 2020, there was 50 overdoses and or adverse substance use reactions that were reported for the town of Parry Sound. So this isn't deaths, this is any overdoses and or adverse reactions, and includes substances in addition to opioids. So this is not opioid specific. But just something that I thought was an important local context piece to include here that's specific to the town of Parry Sound. And that data that I just mentioned at the bottom there was reported through our local overdose reporting system through the health unit, where local agencies and EMS report overdoses directly to us so that we can kind of track the situation. So I'm just going to turn it over to Bruce and Connie just to share a little bit of the anecdotal local context that they're seeing within their roles. So perhaps Bruce, if you would like to share any thoughts first.
Yep, sure. What we've seen from police and an enforcement perspective is it, well, obviously, as shown by the slides by Sam, there is a drastic increase in mostly fentanyl. And obviously the adverse reactions that come from that. We've also seen some adverse reactions come from cocaine, and basically the way, if they're not fatal, my role then is to try and find out and try and determine what might be mixed in this substance that makes it bad. And a lot of the time, if we aren't able to seize something, then I rely on a lot of the users to get some of that information. And sometimes that's difficult, especially with COVID. It's been difficult because I always like to go to the hospital after someone has had an overdose, and if I can speak to them. But that's been difficult lately. And most of the time, they won't divulge to me a lot of the details. Sometimes they do, so I do get some good insight from the users. But it's been a real challenge with COVID, that's for sure.
Okay, so one barrier that we've noticed too is for the isolated communities. We do have a lot of outlying isolated communities, one of them being Henvey Inlet, which is a First Nation community south of Sudbury. In First Nation communities, it's always a barrier of transportation and getting their community members to services. And one of the barriers, especially with COVID, was when there was an outbreak in the community to have the substance use medications, opiate agonist therapy had to be delivered into the community. So there had to be some discussion and planning around that and filling in that gap. And so I've been working with Henvey Inlet Chief and Council to bridge this gap and permanently. As one of the solutions right now, we're partnering with the OATC, so Canadian Addiction Treatment Centers. The OATCs, the 72 in Ontario, fall under that organization, and we've worked towards coming up with where the members and community members that are accessing Suboxone or methadone can have the service directly in their community, access OTN. The nurses are now in the midst of training, and we're awaiting a go live date, and the OATC will deliver the Suboxone and methadone directly into the communities, and the community nurses have access to their system, EMR system, to provide the service. And so hopefully we can look at spreading these kind of opportunities throughout our region as well, if it's needed. Thank you.
Thanks, Connie. Thanks, Bruce. Just to mention quickly, in line with what Bruce had said on the previous slide, but just some of those impacts of COVID that we're seeing and why we might be seeing, this is from provincial experts have identified some reasons why we might be seeing individuals who use substances being at a greater risk during this time of overdose and or some of those withdrawal symptoms. So some things include things such as a scarcer or more toxic drug market. Both of these are kind of related to some of the border closures that we saw very early on in the pandemic, where folks aren't able to get the same kinds of substances into the country and therefore can't get them to the people who are using them. And so in saying that, it's created a bit more of a toxic market in that folks are cutting substances with some more highly potent or highly dangerous substances, putting folks at an increased risk for overdose. In line with that, because of the more scarce market that we're seeing, there's been substitution with other substances. So folks are at a greater risk of an overdose if they perhaps are trying a new substance for the first time, not understanding their tolerance to those substances. Again, just putting themselves or putting at an increased risk of an overdose, sorry. During COVID, as we all know, there's been both an increase and a loss of income, which has impacted the amount of substances that folks are able to purchase. And in saying that impacts both the risk of overdose as well as the risk of withdrawal symptoms that can cause harm. During this time, as we're all here, we were talking about this before we started, that we're all here on Zoom today. So there's been a closure and a change in how services are offered. This has included more limited intakes to be in line with distancing and capacity limits, and a movement to more virtual services, which can be a barrier for folks who perhaps don't have the same access to technology or digital literacy that that others may have. And of course, there's been an increase in using alone due to social isolation. So, there's been an increase in social isolation, which has caused an increase in folks using alone, which of course puts people at a higher risk of overdose when using alone because there's nobody there to respond. We have been promoting locally the overdose prevention line, which is, I can't remember if this is on my slide a little bit later, but there's an overdose prevention line that's provincial, may even have expanded to be national at this point, where folks can call in if they're using substances alone, and the person on the other end of the phone will kind of monitor them. And if the individual becomes unresponsive, we'll call 911 and or to try to get some first responders to respond to that potential overdose. So there has been some movement and work to try to decrease that risk, but it is definitely still a risk and something we're seeing locally. All right, Connie, go ahead.
Okay, thank you. So now we'll talk about the Parry Sound Drug Strategy specifically. So about us, our mandate to collaborate on initiatives that respond to local substance use issues, focusing on the 4 pillars of action. We've now changed these 4 pillars to be called circles of care, and I'll speak more to our logo. Other health units have focused on the pillars in pastel. It just wasn't really fitting for our local population, so we designed this, which I'll speak more to shortly. So we're focusing on prevention, harm reduction, treatment, and enforcement. Our goals, again, are to initiate discussion and improve information exchange between community stakeholders who service or are impacted by substance use challenges within our region, to strengthen community outreach and response capacity, to enhance harm reduction services related to substance use, to improve data collection and surveillance of substance use and related harms, to implement effective education and prevention initiatives about substance use and harm reduction services available throughout our region, and to develop a coordinated mass overdose response and integrated emergency response protocol, and also to respond to the stigma and racism and through awareness, education, and campaign strategies. Next. So the Parry Sound Drug Strategy was launched in February of 2019. The North Bay and District Health Unit is the lead agency for the Parry Sound Drug Strategy. Health units across Ontario took on the responsibility to address the opioid crisis by addressing the Public Health Standards Act to protect and promote the health of Ontarians. A need and a gap was identified in the District of Parry Sound, and a committee was formed. Instead of just addressing the opioid crisis, it was decided as a whole that we would focus on all substances. The provincial strategy focuses again on the 4 pillars of substance use. We decided again to call it the 5 circles of care, including again treatments, prevention, harm reduction, community safety, and Indigenous engagement. Indigenous engagement was important due to the high rate of Indigenous people and communities in our region. And Also, along with how our committee is represented and our strategy. So the Parry Sound Drug Strategy logo design was developed with local First Nation engagement. The Tree of Life represents interconnectedness, strength, growth, insight, and knowledge. And there's other components of that as well. And the 4 colors representing the Indigenous framework, which represents the 4 directions and teachings and inclusiveness of all colors and races. Included in this Tree of Life, you can see, is the root of the tree. And one of our committee focuses is to address the root cause of substance issues or bring that forward. We meet every 2nd month, and the opposite month we have an informed call where we'll bring forward any community-related drug issues. Thank you.
Great, and then just a little bit more about us. I'm not going to go through each of our members in detail. As you know, here on the call today, we have folks with lived experience. We've got the health unit, the hospital, the RAM clinic, and the OPPs. So these are some of our other members, as Connie mentioned, include our First Nations Health and Healing Centers, the DSAB, the town, CMHA, Esprit Place FNIB. So lots of other members who aren't here today. And I know, Kathy, I think I saw put in the chat box at the beginning of the meeting, we are presenting again on February 18th, where a handful of our members have volunteered to speak a little bit more to their actual programs and services and what's offered locally, to give kind of a second look at the drug strategy and a little bit more detail about what some of the services actually are. Whereas today we're giving kind of that high level overview. So please feel free to sign up for the 18th. Oh, sorry, my slides aren't sliding. Okay. So I'm just going to talk a little bit about, so that was a little bit about us as a drug strategy. I'm just going to go through a couple of the strategies and initiatives that we have currently. So we have been working hard over the last couple of years to get our website up and running. We have soft launched the website. It still needs a little bit of work, but it's we are Googleable now, which we weren't before. So on our website, I don't think it's parrysounddrugstrategy.com, but I'm sure if you Google Parry Sound Drug Strategy, you'll be able to find us. We have our mission, our resources, some information about all of our different circles, as well as a robust resource page that includes the mental health and addiction services locally. I'm going to talk about that just on our next slide here. And then we also have our Facebook page, which we try to maintain regularly, but as folks who are involved in social media know, it's almost a full-time job in itself just to keep social media up to date. But we are going to talk again in a couple of slides about an initiative that we have related to the Facebook page. So here we try to share local events, initiatives, posters, educational information, etc. Trying to get that out to the general public. So one of our key priority areas that were identified is service mapping within the Parry Sound area. So it was identified as a need to kind of really understand what programs and services exist locally related to mental health and addictions, and what the referral process looks like for these services. Because one of the issues that we were seeing was that folks on the ground weren't quite sure how to get their clients or people that they're interacting with connected to the services that they need. So we started this process of service mapping what exists. What you can see on the right-hand side here is the resource page on our website, which was kind of our first step to getting that information pulled out. So what we had tried to include was the service, how to refer, so whether it was self-referral, provider referral, call or walk-in, and then just where the service is located and how to be in touch. So some next steps will be to promote this, as well as develop a print resource that we can use. I think it was actually Bruce who brought up how it would be really great to have officers have a print resource available where they could just kind of pull out, be like, okay, you're so-and-so, you're looking for X kind of X kind of service. This is what exists locally, and this is how you can connect with that service. So that was kind of one thing that we will look at doing for next steps. I feel like I kind of went out of order here, but Melissa, I just wanted to give you an opportunity to share. We had talked about the importance of having kind of a resource like this. Just wanted to see if you'd like to share.
I think it's a great idea to have resources because I noticed from my experiences there was a lack of support. And knowing that there is something being done, and I think the numbers will drop in time if people were to access these resources.
Thank you, Melissa. I cut out a little bit there on the end, but I think what I heard was that the numbers will kind of drop in time if folks know what services are out there and they can actually access those services.
Yes, because from my experience, there wasn't much resources or support out there. And as of right now, what we're working on, I have a strong, I know that this will help people in the future if we continue to help with the service mapping and resources that would help people locally.
Yeah, to know what's there. Thank you for sharing. So the next initiative we're just going to chat about is support for family and friends, and I'm going to let Connie speak to that.
Thank you. So one of the gaps that were identified was support for family and friends. One of the ideas that we have, and we're in the midst of launching that, is the West Parry Sound Health Center is partnering with the Parry Sound Drug Strategy to launch a go live event over Zoom once a month for 1 hour. We're going to start off with that and see about the interest. And the goal of this is to provide support and education and resources for family and friends of loved ones who use substances. So more of like an education platform versus counseling. It won't be a counseling, but we could direct people to counseling. And again, it'll be launched off of the Parry Sound Drug Strategy Facebook page. And again, we're in the planning stages for this. Once we launch this, we'll send out information to community organizations and we'll have it on our Facebook page as well. Thank you.
Thanks, Connie. Yeah, very exciting coming up. The one piece I wanted to share quickly is just some of the resources that we have available through both the drug strategy as well as the health unit. We have, so the 3 things on the bottom here you see are print resources. So a lot of these were made in collaboration with the with some members of the drug strategy, depending on capacity. Different committees kind of formed from the drug strategies to create some resources. So on the bottom, you'll see we have things such as promoting naloxone. We have anti-stigma work that's been done across the region. So you might have seen posters such as these throughout the district, including the town of Parry Sound. And then we've got some other resources related to different substances. So like I said, we have opioid resources, we have methamphetamine resources, and we are also working with, so some members of the drug strategy are working to develop some benzodiazepine resources. So those will be coming shortly. But if there's anybody who's interested in knowing what we have available or having resources, there's a lot of, we have posters, small cards. We have a couple of different options that I would be happy to share if there's something of particular interest. There's one other one I was going to mention. Oh, and as I mentioned earlier, in line with some of our opioid resources, we have things like the signs and symptoms of an opioid overdose. We have one on the overdose prevention line, as well as the Good Samaritan Drug Overdose Act. So these are some general harm reduction messaging and resources we have available. The other thing that you'll see here is the drug strategy partner in the implementation of a local sharps bin. So we do have a community sharps bin now available for use 24/7, increasing access, reducing stigma. It's beside the public washroom downtown. The town of Parry Sound technically owns the bin and are charged with the disposal, sorry, word escaped me, disposal of the sharps in the bin. But from my understanding, it's being quite well utilized. And hopefully we'll have opportunities to have some additional harm reduction resources available locally. The one last thing I wanted to mention in terms of ongoing or current initiatives from the drug strategy is the health unit and the AIDS committee are partnering with members of the drug strategy to implement a research project. So we've currently implemented this or have started implementing this research project in North Bay and have expanded to Parry Sound. And what we're doing is really looking to understand changes in substance use behavior patterns for people who use substances during the COVID-19 pandemic. So basically since March of 2020 and how their behaviors have changed during the pandemic. So we're really trying to gain a greater understanding of why overdoses have increased and identify local solutions to complement all the evidence-informed work that we're already doing to reduce these overdoses. So this is something that you will likely hear from me if you're a local service provider over the coming months. For the town of Parry Sound, we are currently in the survey phase. We're doing a survey with folks with lived and living experience of substance use. And then from there, we'll look at doing interviews with folks and then focus groups with service providers to answer some of these questions and get a sense of why we're seeing such an increase in overdoses and what we can do locally to help solve this issue. All right, so then we're just going to get into some next steps in future work. And I'm going to pass it over to Connie for the next couple slides.
Okay, thank you. So one of our initiatives is to increase knowledge and education and strategies to address the drug crisis. So just to note that the research indicates that there's lack of screening in primary care for substance use. Another example is 70 to 95% of people with an underlying substance use disorder have most likely an underlying trauma, most likely from childhood. We like to bring that information forward too as one of our root causes, and which is really important to understand this so that we can bring initiatives to decrease stigma and increase the empathy and look at ways to address this sooner as a prevention strategy. So in my own practice, I've had for the first time, multiple first-time disclosures from adults of childhood sexual abuse, as often being the root cause of their substance use disorder. And they've used these substances in an ineffective way to deal with their pattern of feelings of guilt and shame over the years, coupled by ongoing other life stressors leading to tolerance and dependence. Understanding this aspect may reduce some stigma and promote empathy and understanding again of what they're dealing with. Early identification and intervention serves as a prevention strategy, the same that we would do even if we were going to screen based on recommendations for Cancer Care Ontario. Another resource here is the RAM model, which stands for Rapid Access to Addiction Medicine. So it's a model developed throughout Ontario, launched off of the CAMH. It's called Medify, which stands for a provincial initiative to support healthcare providers in treating people struggling with substance use disorders. With care models, resources for patients as a means to address the crisis and use, but also with the goal to bring it back to primary care, integration and management as part of routine practice, screening and prevention. And so this CAMH Medify can be Googled and you can get all kinds of resources for your practice, algorithms, guidelines. And I do have one of the resources. They do have clinicians' best practices in addiction medicine, a guide for RAM clinicians. And it is for tools for primary care through to hospital integration. And it looks like this. Not sure if you can see that here. And lots of other resources there. Thank you. Next. Okay. So alcohol is linked to being one of the top links to chronic disease, and I'm going to talk more about screening. And so linking to chronic disease and cancer. So if we don't address this, we can't address this, if we don't screen. So screening practices are really important to catch this early, make it a routine practice in your practices, even in your own families, to understand what somebody's drug use or alcohol use could look like, because we know with ongoing stressors in their life or other incidences, it could lead to tolerance and dependence. Catching it early is really important. So something to think about in your own organizations, who's screening your clients in your organization. It would be best it would be the same, as the same context as managing our diabetics, screening for breast cancer, cervical cancer, bowel cancer, making it part of routine screening practices. And we do know that alcohol is one of the leading causes and links to cancers and chronic disease. So really important to do that, getting to that root cause again and addressing it early so that we can save lives. Consider having a rep in your organization, sit on the Parry Sound Drug Strategy, share ideas, get involved in community initiatives, share with your organizations. So the West Parry Sound Health Centre rural nurse practitioner-led clinics have 6 sites, and we've all signed up for the Ontario naloxone program. And I believe we're still in the midst of having harm reduction supplies on site. And so the naloxone kits are really important because it's a life-saving measure for somebody that would be in an active overdose. And you can reach out to myself or Sam if you would like more information on that. Thank you. And I'll turn it over to Melissa.
Hi, can you hear me this way? Yeah. I'll just start off by sharing my lived experience in a positive manner. I would like to share my perspective through my lenses on how to stay on the road to recovery. So for one, my recovery journey wasn't easy, and I tried my hardest for so many years, since the age of 18. I came to realize that this isn't a normal life to live. I came from a community where it was normal to be in a toxic environment while growing up, because it was all we knew as First Nation people. I went to many healing lodges and I attended a few rehabilitation programs to figure out why the cope with my life. Some people may be well aware of the resolution around Canada, and it was a big deal for us to why we have so many wounded warriors as of today. It has caused a lot of damage to many Indigenous around the world. As a child, I grew up with no sense of belonging, no identity or self-worth, and I had a lot of feelings of hopelessness and helplessness. I'm not the only Anishinaabe that felt this way growing up. There are many more that still do, and I believe it is hereditary and it has passed down from one generation to the next. Not long ago, I thought there wasn't a way out and there was no escape from these feelings. I call it forever healing because us Indigenous will forever be healing ourselves because of the hardships that we have endured from birth as Indigenous people. I do have a few tips to share with everyone that are going through some hard times right now, and that don't know how to deal with the trauma and pain. I do have some tips for healthcare providers. So I would suggest to maybe use some trauma-based teachings for yourself and for your staff and clients. And I do have a few suggestions on some books that would educate yourself. It comes from a non-biased way, like about the trauma and pain that us Indigenous people face daily. There's a book on Audible called 21 Things You May Not Know About the Indian Act by Bob Joseph. I would suggest that if you really want to know more about Indigenous people, that's a good book to get into, to read. And there's another one more that would help you on harm reduction. It's about It's called In the Realm of the Hungry Ghost by Gabor Mate, and he shares his views about harm reduction. And I did this resource toolkit for reconnecting Indigenous. I put together and summarized it in a PowerPoint by me. It was made by an elderly lady who worked hard on the Ojibwe diagram for many years, and it has helped her and many other Indigenous to find their way through the darkness of having no sense of belonging or identity. And it has helped me out tremendously, and I now use her oral teachings to help guide me through this beautiful life that I now live and love. I'm a survivor, and I have broken the cycle of intergenerational trauma. My mother and I have been sober for 2 years now, and we look forward to many more years to come. It can be done if you really want it, but there needs to be more understanding to why people use and to why they can't seem to break free from alcoholism or addiction. I believe if we had more trauma-based teachings for all healthcare providers, we will see a drop in numbers in time. And that's all I have to share today. And thank you much for listening to me. And I hope everybody has a good day. Thank you.
Thank you so much, Melissa, for sharing your story and for sharing your tips for service providers. I have one thought. If you happen to have access to the chat, would you mind putting the titles of the books that you recommended just in the chat, just in case folks maybe didn't have a chance to write those down?
I can do that.
Thank you so much. And again, I really appreciate it. So just to finish off here in the next minute or so, we just wanted to do a bit of a summary of some steps that you can take as local service providers. So in terms of things that you as an individual or organization can do to support people who use substances, so you can incorporate the 5 circles that we mentioned related to the drug strategy, for example, screening, harm reduction posters and messaging, becoming more aware, educating staff to help reduce stigma, and as Melissa mentioned, have that trauma-informed lens, and understanding how racism can play into substance use care, which goes hand in hand with understanding our own biases and perceptions. And then of course, becoming a champion within your own organization to incorporate all of these recommendations. And that is all that we have as presenters, unless any of our presenters have any final thoughts or things that they would like to add before we open the floor up to questions. Can I just say that I'm really impressed that we were exactly on time? I'm just going to put that out there. All right, so I'm having a hard time seeing the chat box at the same time here as presenting, but if folks do have any questions, feel free to either unmute, raise your hand, or use the chat box.
Perhaps stop sharing, Sam.
That's smart, thank you. I will just say that within our slides, we do have just a couple of reference pages just for folks' awareness. Thank you. That's way easier. All right, so any questions, feel free. I see Melissa added the book titles into the chat box, so if you didn't have the chance to write them down, they will be there. All right, well, not hearing any questions. If you are interested in learning more or becoming a member of the drug strategy, I will put my email address in the chat box. I recognize that I didn't have a contact slide there at the end, so apologies for that, but I'm happy to be a contact if folks are interested in joining the drug strategy. I will put my email address in the chat box and you can reach out to me at any time. Oh, thank you, Connie. Connie's also threw an email address in the chat box there.
People can also reach out to me and I can forward their questions on to you ladies as well.
Yes, that would be great. Thank you. Oh, yes, Jim, I see your hands up.
Thank you, and thank you to the panel. I'm really grateful for the information, and I work. People know my role as the communications officer in health center. I'm really involved, but I'm frequently surprised by the scale of the problem, by the impacts of the problem, and I wonder if the people on the panel would share any insight they might have how communication could play a role. I think I get a sense that opinion leaders and maybe just the regular public in our community don't understand what's really happening. I saw the really good work that Officer Joe Scally was involved in. He was talking to the local newspaper about the impact on police officers and families in the community, but maybe there's a need for more of that. I think a lot of people don't really understand how big the problem is.
Yeah, I can maybe share first. So thanks for that. I appreciate the thought. So definitely something that we, as the drug strategy, try to promote and get out there, as well as the health unit, my organization, is we do have a lot of kind of like those resources that I shared on the one slide, just trying to educate the general public about what an overdose looks like, what an overdose response looks like, and how people can kind of be aware of what's going on in our community. Though I do recognize that perhaps, like to your point a little bit, maybe sharing some communication or media release, something like that, that highlights the issue a little bit more broader so that people get an understanding of what's happening and then why these resources that we're releasing are quite important. So maybe that's something that we can look into for sure. I don't know if that really answered your question, but that was those were kind of the first thoughts that I had. And maybe something I can do too, Jim, is include you in some of our communications emails where if we have these posters and resources that are available, can send them to you to disseminate through the hospital channels if that's something that you might be interested in.
I would be really interested in that, and I would be happy to help. We send out a weekly newsletter that goes to 700 internal email addresses and probably 300 or 400 external. So we'd be happy to amplify any messages that the group has.
That's great. I will definitely make note of that and be sure to include you moving forward, because that's amazing. That would be great. Does anybody else on the panel have any thoughts related to the question?
I do. So we consider in primary care, in healthcare, that blood pressure, hypertension is the silent killer, because often we start seeing issues and kidney problems and other healthcare issues, finding out too late that somebody has had untreated hypertension, and often we don't have any symptoms until there starts to be some damage going on to the body. I would say the other silent killer is drug use. It's well hidden. We don't know a lot about it. It's not portrayed enough in the media. I think because of the stigma and I don't know why it's not well, I guess maybe protecting privacy. But I think that if we could be more aware that this is a worldwide global epidemic, just like COVID. So people are dying even more of overdoses than COVID deaths. We really need to pay attention to this. And yeah, we really need to understand substance use disorder impacts doctors, nurses, our friends, our loved ones, just like the posters we showed in this presentation, all loved ones, grandparents, neighbors, it's all around us. and it's well hidden. And again, I consider this to be a silent killer. And I hope that we can bring this forward in other ways to save lives and save lives of our families, loved ones, and know how to help better. Thank you.
Thanks, and thanks again for the question. Are there any other questions from attendees? All right, so I don't know about anybody else, but not seeing or hearing any. Maybe we'll kind of leave it there for now, and my contact information, Connie's contact information is in the chat. If you do have any follow-up, feel free to reach out.
I'm just thinking that people are saving them for the 18th when you're back again, Sam.
That's okay, I'll be here. Yes, please feel free to sign up for that presentation too.
Well, thank you very much to our presenters today. It was very well done. And Melissa, I appreciate having the your perspective added to the panel. That was good. And yeah, thank you. So we'll be back on February 18th with the second part.
Awesome. Thanks, everybody. Have a great day.
Thank you.
Thank you.
Miigwech.